I'm going to. Good afternoon. Welcome to TALAHour, everyone. I'm Diana Martinez, President and CEO of TALA. I've got my vacation wannabe imagery in the background. Hopefully I'll actually get to a beach here in a couple of weeks. I hope everyone is enjoying their Friday. I really thank you for taking this hour to join us. We are super excited today to talk about value-based care, which is huge in the assisted living space. Our topic is improving outcomes and empowering operators, unlocking the potential of value-based care. We are joined today by Dr. Justin Schramm. He is the co-founder and CEO of August Health. His areas of expertise include innovative care delivery models, chronic disease management, digital health, and value-based care. And he is joined with Lori Caldwell-Jones. She's the Chief Operating and Chief Clinical Officer with 12 Oaks Senior Living. She has 21 years of experience in the senior living space. So we're super excited to have them with us today. Just a few technical issues, well, not technical issues, technical advice. If you would like to ask a question, please either use the hand or the chat function. I'll be monitoring both. We'll probably wait until the end to take questions, but if you want to ask them as we go along, and then we will field them at the end, that would be great. And without further ado, I turn it over to Justin and Lori. Thank you so much.
Thanks everyone for joining us. We know you're all busy running communities. We appreciate you taking the time to join us and learn about this topic of value-based care. Just a little context to set the scene before we dive in. Lori and I met because August Health is an electronic health record purpose-built for senior living. We're a newer sort of modern EHR focused on the needs of assisted living and memory care. And one thing from my background as a physician, having participated in value-based care arrangements in the setting of long-term care in my career and prior careers, I saw how value-based care would be coming into the senior living space. And so we've built out this EHR with the capabilities to really empower operators who are looking to shift their care models to take advantage of and excel in value-based care frameworks. And as our talks with 12 Oaks were getting started and they were evaluating our EHR sort of generally, we really connected on this topic and on our shared sort of missions and goals in value-based care. And that is why Lori and I are coming together today to talk about this topic together. Lori, would you like to introduce yourself and expound on that a little bit?
Yes. Hi, everybody. I'm so honored to be here with Justin and talking to you all about value-based care and diving into it. I'm very excited about it, very passionate about it, and it has been really exciting to work with Justin and August Health. They are literally helping to get us into this century, if you will, with technology, which is a part of this conversation and presentation today about how important technology is. August Health provides our electronic health records and the visibility that we need to continue to provide proactive, outstanding services and care for our residents. So very happy to be here with you, Justin. All right, shall I get started?
Let's go.
All right.
Okay, so value-based care. A lot of the things that you'll hear under the mantle of value-based care are things that you're doing today as senior living operators. It just really focuses on the importance of providing good, proactive, and personalized care to our residents, having a little bit more emphasis in tracking health outcomes, which is, I think an area, where the industry as a whole potentially can improve in tracking KPIs around health outcomes, and thinking about the interfaces between senior living and the healthcare system. How are we coordinating care How are we partnering with high value providers who really understand our residents and know how to partner with us, who know how senior living communities run, identifying those partners and really working and coordinating with them. Because ultimately, we're in the senior living industry, providing the housing and the care services and the socialization and the meals and the medication management, but we rely on our partners, primary care, PT, OT, et cetera. And it's better to have ones who understand what we're doing and understand how to coordinate with us, we can communicate well with. So that's a very important part of excelling in a value-based care framework. And finally, having the systems, both the technology and the data in place so that you're shifting your care model from being sort of reactive, like something happens and we need to then just take care of it, to identifying rising risk residents, using some modern technology, intervening early, and helping to make sure that we get the best outcomes for our residents, prevent unnecessary hospitalizations, and help people to age in place. When you think about value-based care, I think this really applies to everybody. I think everyone can get behind some of the goals here. It's essentially are to deliver better care to our residents, improve, health outcomes, make sure our communities are run efficiently and can serve in the highest capacity to provide the best health outcomes to our residents. I think that's something we've all always done. What's new in the framework of value-based care is that based on the way healthcare is paid for in America, with a lot of Medicare shifting from fee-for-service to value-based care, where health plans are looking to improve the health outcomes of the residents and reduce total costs of care. To the extent that the senior living operator is helping to support that, there's new emerging opportunities for senior living organizations to get involved in getting paid for the value that they create for the healthcare continuum.
Right. So, as Justin mentioned, we really want to improve outcomes. And in order to do that, we have to help our residents have more healthy days at home. The longer our residents stay with us, the more we can enhance their well-being. Of course, this means better overall wellness and happiness for our residents and our families, higher satisfaction for residents and families. And also what's important is for our residents to be able to maintain and have those stronger social connections and friendships within the community. Overall improving our length of stay at the community. And by responding quickly and efficiently to health issues, we are able to focus on preventing problems rather than just reacting to them. So a goal to have less adverse effects. And then with on-site medical support and diagnostics, then we're able to provide the care our residents need right here, reducing unnecessary hospital visits. So how do we do that? Our seniors deserve the very best when it comes to healthcare. And in our communities, we have a really unique opportunity to go above and beyond and focus on holistic and equitable care right at the community level. And this isn't just about the traditional healthcare, it's really about enhancing our the residents' overall quality and being very proactive and focusing on safety, cleanliness, nutrition, care and services, as well as activities. And by bringing together the different healthcare services and clinical practices, we can offer a much more comprehensive resident-centered approach to care. And again, this approach is all about quality over quantity, and it helps us focus on the best possible outcomes for health and wellness. And so how are we doing that is by prioritizing resident-centered care through team-based planning, building these strong partnerships with therapy providers, physicians, and pharmacies, and enhancing assessments and fostering better communication. Committing to the ongoing training and staff education is critical, and for the continuous quality improvement through key performance indicators. For care model innovation, traditionally care and services in senior living has been task-oriented and reactive, and oftentimes this leads to a lack of coordination between healthcare providers, and therefore it also can potentially lead to gaps in care. For example, when emergencies happen, we usually send residents to the hospital, and from there, they may end up in a skilled nursing facility, and there is a medical director on call to provide support. But with value-based care, and why we're super excited about it, is it shifts to the outcome of care. And so the providers, which include all of the care team at the community level, as well as the partnerships that we'll discuss achieve the best possible health outcomes. And we're incentivized to achieve these outcomes. And so the approach not only improves overall health, but it also reduces the need for additional treatments and overtreatment. So it therefore significantly enhances our residents' experience. You might have heard the term speed to lead, for example, in the sales world. Well, with value-based care, it's a focus on speed to care. In the senior living environment, it means that our care teams will now include medical providers, therapy teams, and other professionals who will collaborate closely with our on-site care teams to ensure comprehensive assessments and care planning. But in order for this to happen, as I was saying earlier, and working with Justin is so exciting, but technology plays a really critical role in this care delivery process, especially as we focus on those outcomes. And in order to achieve the best results, we have to be able to assess, we have to have visibility into and be able to measure and follow up on key performance indicators. And health technology, for example, in the case of August Health, with having electronic health records, it's critically important for tracking and sharing that health information seamlessly across the care team, especially as we introduce other care members into our senior living environment. We have to be able to talk to each other, and technology is critically important for that. And along with that comes the data analytics, because in order for us to provide better care and services, we have to be able to collect and analyze the data and understand those metrics and the outcomes that we're striving for. This also is helpful for financial performance. Another piece of the innovation is the predictive analytics, and that helps us to identify seniors who are at risk and allows us to tailor our interventions specifically for them. And then we have to have the visibility to review trends and track trends and focus on preventative measures to standardize our quality metrics to ensure continuous monitoring, feedback, and improved care delivery. Again, health records oversight through technology, we can have the ability to oversee our health records much more efficiently than we do with paper. That's always a challenge with sometimes nurses, is getting us into the electronic world, but technology is important for that. And then we have other innovation like telehealth. On-site telehealth supports the diagnostics to make it easier to collaborate with pharmacies and labs, not to mention the ability to provide those services and keep our residents in our communities longer. And then resident engagement. So we have other areas that can include platforms for resident engagement and dining services.
Absolutely. And just to piggyback on some of your comments there, Lori, in my prior life as a medical director, managing a team of clinicians going into senior living communities, it can be very challenging to know what's going on with, our patient, your resident, who has maybe undergone a change of condition, the doctor gets called, to be able to piece together what happened, get the latest set of vitals and medications, and see what's been happening in terms of the care and the charting shift over shift. If those aren't cleanly organized in a system of record that your partners in the community can then tap into to get all of this information. So the days of it being sort of scattered in paper or whiteboard, sticky notes, except maybe Excel, that made it very difficult for me in my past life to be able to partner with senior living communities to be able to provide the best quality care. So a lot of those systems oriented things that Lori was talking about, I was just reflecting on my past life and how relevant her points were there. Why are you as a senior living operator so vital in the value-based care continuum? This really, I think, brings it home. Social determinants of health account for 80 to 90% of health outcomes. So the services that you're providing in nutrition and dining and transportation, socialization, exercise activities, having housing that's safe for older adults with mobility issues, not having stairs, steep stairs, missing a handrail, rugs everywhere. These are the services that you're providing that provide a baseline of safety for your residents and allow them to age in place without a lot of the risks that they may have incurred in a private home without adequate support. I speak to this very personally because in my prior role as a physician, when I did a lot of house call medicine alongside the visiting communities, I would meet older adults probably pre-move into senior living and would see this struggle of being able to get their medications on time, of being able to get out to their doctor's appointments, of even having food security. You know, even if the family could afford food, and so not all can, but or afford great nutrition, they wouldn't get 3 square meals a day because they weren't capable of doing it themselves, and maybe there were some holes in their social support systems. And so I cannot underemphasize how essential these services that you provide are. But then, you know, what does this actually mean in terms of the data? How this you can make this sort of correlation, but there's actually been some good research done, which we'll show you on the next slide. NORC, which is a research institute out of the University of Chicago, partnered with Nick to look at how moving into a senior living community can impact frailty scores for older adults. And what you're seeing on the graph here, the sort of dip after that dotted line is the move-in. You can see that folks' frailty scores just kind of before moving into senior living are going up, up, up. And then after that move-in, they kind of level out and then start dropping. And I have seen this clinically, you know, and it's great to see the studies to affirm that when you start addressing all of those social determinants, as we discussed on the last page, and people are getting their medications on time, they're getting their meals on time, you see a rebound, you see that improvement, a reduction in frailty that was well illustrated here. Diana also alerted me to the fact that Texas had done a study on this. And so given we're with the Texas crew and TALA, I wanted to give a plug for this study that was done by HHSC. And what they found was that the outcomes in senior living were great. It's actually a really positive report that the state put out on the assisted living industry in Texas and the care that it was providing, both in terms of how residents rate their health status, and improvements that they've seen since moving into senior living, and, you know, benchmarks around mental health.
So let's talk a little bit about 12 Oaks and what we're trying to achieve at 12 Oaks. Number one, I'm very excited and proud to be a part of this organization. At 12 Oaks, you know, we are always aiming to shoot higher, and our goal is to be best in class. We're not just satisfied with staying the same. We're constantly pushing ourselves to improve and be better every day. We're very committed to our core values of character, competency, stewardship, and servanthood, and we demonstrate those by our goals to deliver top-notch care and compliance. So value-based care is very instrumental in that. You know, we are acting responsibly on behalf of another, which is our core competence or our core value of stewardship. Our goal to maintain that strong occupancy, have high levels of occupancy while managing higher levels of care. Again, value-based care being critical with that, is operating with excellence, and that's our core value of competency. We strive to provide an exceptional experience for our residents. That's our core value of servanthood, serving others while achieving the goals. And then we strive to celebrate our recognized achievements, which is our character core value, the ability to meet the demands of reality. So our goal is to lead the industry, and I feel like value-based care is a great way to kind of dip our toe in there because it's new, but it's exciting, and it's something that we can really see the value in. Our goal is to achieve exceptional outcomes, and this is measured by keeping occupancy stable by residents staying longer, so greater lengths of stay. We strive to reduce falls and hospital visits, eliminate medication errors, minimize reliance on medications, collaborate through quality assurance meetings, and prioritize preventative and proactive care. And then ultimately, of course, our goal of achieving satisfaction and creating a happy community. But this is measured by our satisfaction of our residents, our families, our associates, and our ownership groups that we serve. Staff retention is critically important in that as well. And, you know, we want to continue to have that consistent quality of care. So satisfaction at our associate level is also very important. And how do we get here? Well, you know, if you think about where we are today in senior living has often lagged behind in addressing key issues that has led to several challenges and gaps. And we have ongoing staffing challenges in this industry. It results in inconsistent care. It results in high turnover. We have a lack of on-site medical services. In some cases, communities will have therapy on-site. In other cases, not so much. Mental health support, physician visits, x-rays. this limited care is definitely a gap we strive to overcome. Transportation challenges make it really hard for residents to attend off-site medical appointments, and this can also cause challenges in missed or delayed care. And then inconsistent communication and a lack of continuity of care also make it difficult to provide seamless support. Constant turnover, will lead to fragmented care, as well. And then when we have constant turnover, trainers are not versed in management of complex medical conditions, dementia, diabetes, mobility. So when we have constant turnover, it's going to lead to continued turnover because we don't have that consistency with staff training. And the insufficient training also we recognize we need to be able to recognize and respond to the emotional, psychological, and social needs of our seniors, especially those with cognitive impairments. And then social isolation is a real issue in senior living, and residents, will feel lonely or isolated due to a lack of meaningful activities, social interaction, or physical barriers. And the physical barriers is really an area where value-based care can come into, because we're really trying to be proactive in keeping people healthy and well to be able to participate in those social opportunities. Poor dietary options, inadequate meal planning, and a lack of individualized nutritional care can lead to malnutrition and other complications. And then health assessments aren't always conducted consistently or in a timely manner. So there's insufficient monitoring of chronic conditions. Then again, a lot of this is all on paper. And again, we're not always have the visibility to continue to improve our outcomes. So what do we need? Well, we have to challenge the status quo. We shouldn't be settling for how things have always been done. We can do better. And that's, again, why I'm excited about value-based care. I feel like it's like light shining on the way things could be and should be done. And, we focus on keeping our teams happy and motivated. We need to ensure that residents have quick and reliable access to the care that they need. And we need to work together as an interdisciplinary team to provide the best care possible. When I say interdisciplinary, I mean we're moving beyond just having all the responsibility land on the shoulders of a resident care director or a director of nursing. And we're improving that collaboration with other care partners, the rehab teams, the physicians, nurse practitioners, care coordinators, hospice, and other team members. And then the regular training from knowledgeable professionals, which also comes with this collaboration, is absolutely essential, because we can have better onboarding programs for our team members, more routine training on managing complex medical conditions, and a more holistic understanding of resident needs. Holistically, again, emotional, psychological, social, memory care, and ultimately technology. Again, it comes back to the technology here. It's important to enhance our assessments, to improve our outcomes, and to foster better communication and collaboration. And this is where the electronic medical records come in. Thank you, August Health, resident experience, and dining programs. Okay. All right, so how do we get buy-in? Well, change is tough, especially for our care teams. Like I said, nurses are the worst when it comes to wanting to change from paper to electronics, but we need to get everybody on board: staff, residents, families, and ownership groups. It's critical to understand the value and the why behind the why as we're making these changes, and we've got to be able to sell it to the team. So when we communicate the benefits, like improved resident satisfaction, reduced staff burnout, then this will help create a more collaborative, resident-centered approach to care. And then senior living we've got some catching up to do in the area of data and technology. Our electronic health records, Yardi, and other health information technology systems, they need to communicate with each other effectively. And if I can say anything, vendors need to work together towards seamless integration, because this is so important for us as operators to be able to have that integration and seamless communication, and basically playing nice in the sandbox, if you will. And we're shifting from focus on volume to outcomes, and this brings its own financial challenges. But coordinating care across multiple providers and settings can be very complex, and it can lead to challenges in ensuring ongoing continuity of care, making seamless coordination more important than ever. So opportunities, well, we need to focus on actively engaging our team, educating everybody involved, and showing the value of what we do. We need to work smarter we need to, so that we can get the better results that we're striving for our residents. And we also, need to continue to be cost conscientious. And when we save together, we all win. This helps us stand out in the industry by providing that top tier care. And as I was mentioning, striving to be best in class. And if we persevere, we can improve outcomes. We're going to reduce the hospital admissions. We're going to enhance the overall efficiency of care as well as resident and family satisfaction. So some of the options is we have to kind of look at who the pros are, and there are pros out there. So Khurana is a pro. Khurana and Servium are the pros in value-based care. Khurana will actually provide an on-site coordinated care. It's kind of the full package deal. They provide the nurse practitioners, care coordinators. It is shared risk. They will do weekly rounding at the community level. They'll give access to the care on site, evaluate baselines, provide education, coordinate with specialists, focus on quality outcomes, be involved in the quality assurance meetings, and support pharmacy and mobile lab. And Servium also partners with Khurana, but they also support pharmacy, diagnostics, hospice, and lab. Then the other areas that we consider our pros are the rehab teams, our hospice teams, and our pharmacy teams, and our mental health services. Now, technology, this is again where I was saying that we need to really be able to send data back and forth in real time inside and outside the organization. And this is so that we can see the full resident picture, because as we're making assessments, as we're care planning, as we're looking ahead and trying to be proactive, we've got to have visibility, like I said, into our residents and the current picture, as well as what the future picture needs to be for them. So these are the areas that we really need to make sure that we have. We want to build our referral partnerships, but we have to have that shared document platform, and we have to have a really good dashboard for key performance indicators, as well as be able to measure cost and utilization and see the full resident picture. So getting ready for higher acuity, we got to assess the team and provide the necessary education. We need to set clear goals and expectations so that everybody knows what's needed. We need to use data analytics to spot high-risk residents and potential issues early on. And we have to establish a system for continuous care and regular follow-up. Leveraging technology is critical, and it's important, again, like I mentioned, for early intervention, and we have to be able to measure and track progress to ensure that we're on the right path. So how do we get our clinical teams, our care teams excited about it and get their arms around it? Well, it's about the benefits. We have to sell it to them. We have to make it real for them. We have to say what's in it for them, and them getting better, having us all have better outcomes and happier residents is key. Improved job satisfaction for everybody, a better work-life balance because we have better staffing. If anybody knows, there's a lot of times we're working overtime, but having better staffing helps the care team see that, look, I'm going to be able to have more balance in my life. And then we need to stay ahead with the latest innovations and trends. And that's that's kind of an exciting thing if we can get our care teams excited about it. So how we empower them is, again, like I mentioned, our goal is to be best in class. So we need to offer comprehensive training on value-based care principles and keep learning opportunities ongoing. So it's not just a one and done. We've got to consistently create ways to have that ongoing training, and we need to involve them in the decision-making. And this is, rather than talking at them, we have to work with them and seek input from the team on how to implement it within their community, how the care initiatives can benefit them, and creating committees or task forces within the community teams. We want to make sure they have what they need. Tools and resources are critical. And so this is, again, we're investing in technology, supports the value-based care, and we need to make sure that everybody has access to that relevant data and the analytics. Establishing measurable objectives that align with value-based care, and we need to make sure that we are regularly reviewing and discussing progress and measuring. So implementing incentive programs tied to value-based care metrics and celebrate both the team and individual achievements. And then, of course, we need to encourage the team to experiment and learn from setbacks. So continuous quality improvement is critical. We have to let people fail and recover, and we learn as we go, and having a safe environment that this is new and it's not going to be perfect along the way, but it's okay. We're going to have setbacks, and we just have to have those feedback loops to help us measure and move forward. Very importantly, the leadership of the organization has to believe in it. We have to lead by example. We have to show the commitment to these principles. Because if we don't believe in it and we're not valuing it, then our teams aren't going to value it. So it's critically important that we're leading by example, and that we're creating those open channels for feedback and discussion to provide that support for anybody struggling with the transition.
Lori, thank you so much. I think, any sort of transformation in any organization, requires, people, process, and technology. And one thing that I found real exciting about partnering with 12 Oaks is how intentional they've been about creating a culture of innovation, and in creating change, they specifically call out change management and hold leaders accountable to saying, here's why we're making this change. Here's our goals, and getting everybody on board with that. And so I think to stay on the cutting edge and to be very competitive in your marketplace, the kind of leadership and innovation and change and transformation that 12 Oaks that's just part of their organization is very impressive.
It's Justin.
Speaking to that sort of culture, I think there's also sort of emerging thought leadership, within the industry about how to make this transformation. Lori called out Servium and Curana. I want to actually credit them because I gave a presentation, Alan Fairbanks of Servium with Mark Price of Curana at Argentum on this same topic. And some of the slides here, we worked on together. And so I just want to credit them, along with Stephanie Boreal of Watermark. Watermark has made a lot of early strides in value-based care as well. And I think is another example of an operator making this change, making this transformation. And the lessons learned from these early entrants, I think, will help to bring others and help to create this transformation as well. All right. So in terms of what I want to talk about is this kind of systems innovation that you can put in place to prepare yourself for success for value-based care. And this isn't to say that you need to start contracting around value-based care. I'll talk a little bit more about that and how one might get paid a fair share for the value that they create. But even if you aren't thinking about contracting for value-based care, the principles that you can and the systems that you can put in place today will help you to succeed in your current business model and community care model, and whether or not you choose down the future. But you want to either way start thinking about this and get systems in place to improve resident care outcomes and operational efficiency. When I look at senior living, and I came into the industry, there was like a debate which was about is senior living a hospitality model or is it a healthcare model? And there's kind of positions on both sides. My belief is that it's both, and that we need to have the systems to be able to transition the residents in our community who are in that hospitality model, which is probably 90% of the residents at any one time, into the healthcare model. And that's those 10% who have undergone some change of condition. It's sort of the paradigm. It's not a hospital and it's not a hotel. It's somewhere in between, and it's fluid. Some of those folks are just getting care according to their service plan. This is their home. Care is embedded. Others have undergone some change of condition, are higher risk, and we need to be able to shift our care team to really focus attention on those individuals. So I'll talk about that for alert charting, analytics for proactive care. I think we all need to be using data to identifying rising risk residents and put in the effort proactively to prevent downstream adverse events or bad outcomes. And then performance improvement. How are we tracking these things over time across our communities? How are we building a culture of accountability around the outcomes in our community? So first, on alert charting, this allows you, whatever system you have in place, and some people do this on paper, some people use technology, it's just crucial to have a system in place to focus the team's attention on high-risk residents and changes of condition. I think this needs to be on the highest sort of order of priority of when your care team comes in for the day. that they are aware of which of the residents in the community, and maybe it's 100 residents in your community, which 10, may be vulnerable in some way. They've had returned from hospital, maybe they were found down, maybe they've started an antibiotic, perhaps there was, an elopement or some other event that indicates that this individual is higher risk. We need to check on them more frequently. We need to be monitoring and observing them shift over shift, communicating very clearly what happened. Everyone should be aware of what's happened, which of these residents are on alert, how their care has evolved, making sure to assess the dynamic situation with an evolving plan of care, and make sure the leadership is aware of what's going on. And there's an easy way for them to do that. So I'm sure most of you have some form of alert charting system in place. Getting this dialed in, I feel, is really crucial to help us shift between that hospitality and care model and back to dynamically serve those residents who are needing higher levels of observation than might typically be the case in the community. One thing that I believe is really important for this industry, and something that I've been trying to bring forward the importance of, is we're collecting a lot of data in our electronic systems. One, I would say your system has to be intuitive and super easy and make people's days easier so that all the information gets in the system, because analytics are only going to be as strong as the data that you put in. If your system is bypassed because it's frustrating to use, or there are too many clicks and the information ends up going elsewhere, your analytic, it's kind of like garbage in, garbage out. The data isn't going to be accurate or helpful. So one, like, we need a system of record that is super easy to use and makes people's days easier, because then they're invested in getting the information in there. And when you do, there's all these signals from the charting that we do, whether it's a fall or a hospitalization, weight loss, weight gain, skin issues, using call lights more frequently, all these little signals that indicate to us that, hey, this resident's risk profile may be rising. And too often we've been reactive and find out after the fact, when doing root cause analysis, that there were signals that were happening earlier in the course. We just didn't make the change. And so it's really hard. It's such an intensive operational business, assisted living, to track every single chart automatically. This is something that technology should be doing for you, is surfacing those rising risk residents and helping you intervene before that bad outcome. One example of this, I think of as like the resident watch list. This is where, which is something that we're doing at August Health. We're within our electronic health record, we're capturing those residents who have had more incidents, falls, skin issues, ER visits, hospitalizations, significant weight loss, weight gain. And we are putting that into a dashboard where you can see, and you can filter or sort by all these categories. So one thing I encourage our communities to do is filter based on the care level. And if you have rising risk or high risk residents who are care level 1, these are probably your low-hanging fruit for folks that you need to go out and reassess, right? Because they're getting more care than a care level 1. If they're falling on this high risk, dashboard, their care plans probably aren't updated to address the level of need. And so I think in these cases, you're probably providing a lot more care than you realize, or the service plan is the service plan isn't intensive enough for their needs. And so get ahead, reassess these folks early, get them into the right care level band, make sure their service plan adequately addresses their needs, and fully evaluate, why are they high risk, and what are we doing to address that risk proactively. This is at the individual resident level. Now let's think about it at the community level. These are some of the KPIs that our partners will be tracking and doing it across their whole portfolio of communities. You can see the list here. There are others that are also important, and sometimes it depends on your particular preferences and what you want to focus on for your health metrics or health outcome measures and KPIs for your community. One thing I really encourage folks to do is not just to look at in this example, we're showing you like the total number from the prior 90 days for all these different communities. And it's good to know the total number, but you're comparing communities that have 100 people against communities that have 50 or 20 people. So just looking at the gross number alone can be misleading, because if there's more residents, there's going to be more events. So we also provide a view of this that looks at the events normalized based on community size. So you can compare apples to apples rates of incidents and not just the gross number. And so I don't have both of them represented here, but I encourage you to not just look at the total number of incidents and the trends, but also look at the rates of incidents so that you can look across your portfolio and identify where you might have to have a closer look and quality assurance root cause to try to improve performance across your communities. So the last section is getting paid for the value that you create. And well, you can go to the next slide. I think one thing to highlight is that by 2030, all Medicare beneficiaries will be enrolled in some form of value-based care program. So Medicare Advantage is classically, the value-based care program that is now up to about 50% of all Medicare enrollees. It's been an incredible growth in the last 10, 15 years. There's transformation happening in our healthcare system. And, the Medicare enrollees, live in our communities. Now that most of them are half of them nationally are part of, Medicare Advantage programs, we should understand that Medicare Advantage is a value-based care program. It is looking at total cost of care, resident health outcomes, quality measures, and this is how the health plans are being incentivized, and they're passing on those incentives to the physicians that are caring for their members. And those physicians are coming into our communities to care for the residents. I was one of these physicians, and they're contracted with the health plan. What some of the innovations that have happened are groups like Servium and Curana, where they've recognized that the community should be part of this value-based care program, where whoever's taking risk on the residents, and risk being, looking at the total cost of care, trying to optimize health outcomes while reducing total cost of care by preventing unnecessary hospitalizations, preventing unnecessary, utilization, which there is unfortunately rampant overutilization especially for older adults who are sent to the hospital for reasons that probably weren't necessary. If you can be a partner in helping to improve quality and cost, there's an opportunity for you to take part in some of the upside. So whether it's a Medicare Advantage strategy, and now through ACOs and direct contracting, even original Medicare fee-for-service is being folded into value-based care programs. So how do you do this? Contracting with an ACO is one option. Working through Medicare, Advantage is another option. In either case, thinking about your strategy for who the primary care providers are in your communities, and are they aligned and trying to achieve the same goals? I think Lori spoke very well to this. I think it's hard for us as senior living operators individually to get the scale that we need to set up a Medicare Advantage plan and have the whole back office for that. So that's where the groups like Curana come in, and Curana has a whole, a back office that helps to create, and maintain health plans or consortiums of operators who participate in Medicare Advantage or ACO programs, and they help the senior living communities to run those programs, and they have the experience both on the plan side and with the primary care physicians. And then Servium is doing the same. Servium, they come from assisted living. They were, incubated and grew out of, Bickford Senior Living, who's also one of our very close partners at August Health. And they have pioneered applying value-based care models into senior living, and have created consortiums in several states where assisted living providers can join these consortiums, and then together they're banding together and forming value-based care programs and contracting with health plans, with with Curana, and provide an additional, all the sort of technology layers and the process layers. Servium has really dialed that in for senior living and helps to bring operators together to innovate in this space. And so I think if you are thinking about moving in this direction, these are two great groups to reach out to. Curana is very active in Texas with their physician group. You can talk with them about opportunities to get involved in contracting. And then Servium is growing nationwide, and Texas is certainly on their list. And I think Lori would be a great person to talk to as well. She's involved in these discussions. So things to consider. What is the impact on your overall healthcare strategy? How are you, what's the impact on residents and staff in terms of the quality of care and their experience in your communities? How are you differentiating yourself and your services as a senior living operator? And there's different ways that you can dip your toes in. You can go deep or you can go shallow. You can start shallow and go deep over time. And so working with Curana and Servium and others can help you to understand your options here. They're both very close partners of ours, and I can highly recommend both of those groups. So in sum, there's transformation happening in healthcare and Medicare, the way healthcare is being paid for. There's a shift to value, controlling total costs, optimizing quality. You are an essential part of that transformation, and now you have an opportunity to participate in it. So thanks so much for being part of this webinar today. I'm not sure if there's questions, Diana or Lori, if you have anything you want to kind of add here at the end.
I don't have anything additional to add. Thank you, Justin. Appreciate the time to be here.
I got a question. So it's a lot to digest, right? For someone that's just starting to hear about value-based care and how that model can fit into senior living. What would be your recommendation of an additional resource for someone that wants to start learning more and seeing if this is something that would be doable within their community?
From my perspective, I have to agree with Justin that reaching out to Curana and Servium is a really good start to kind of understand it more. That's, we've learned about it a lot through them, and a lot through, as we've been investigating the technology realm too, as well, through August Health and Justin, we've learned about it as well. So
yep, I think it depends, which aspects do you want to start with? If you want to start with the primary care, aligned primary care, potentially, rehab, talking with partners in your community who you can identify as preferred, primary care providers who are going to understand the way that you operate and coordinate closely with you. I think that's one place to start. In terms of having the primary care physician group, Curana is one option. There are others. Next, I would say, if you're looking at, systems and technologies, do you have the systems in place to be able to do the kind of, alert charting, the kind of, identifying rising risk residents early? Are you able to look at KPIs across your communities? Those are the sorts of things that you'll need to have in place to succeed if you choose to go in the direction of contracting around value-based care. If you jump straight to contracting, but you haven't sort of got your communities operating in an effective way, then you might have difficulty succeeding in those contracts. So getting performance in place first. And so Lori talked about a variety of different systems and technologies that you might consider. So that's another sort of angle in. And then I don't think it's too early to start learning about the health plan and contracting and your different opportunities there, taking upside risk, downside risk, getting quality measures in place for your communities. Because if you're driving in that direction, to know what that looks like sooner rather than later is a good idea. And so in that case, I think Servium is a really great bridge between, they come from operators and they're making these connections into value-based care. So those are some of my thoughts of ways to get started.
Have you heard of any states out there that are looking at requiring data capture at the community level? It was a question I actually got the other day, and I hadn't heard of any states looking at trying to require assisted livings to have a certain, data set on different types of performance measures. Have y'all heard of any states out there that are looking at that to see about regulating that?
Oregon has moved in that direction, and Washington is exploring it. Those are the first two that come to mind for me.
Okay, great. That's good for us to know. We'll definitely keep on that and monitor that. Does anyone have any questions? You can use the chat or raise your hand. I really appreciate both of you being here today. August Health, of course, is one of our industry partners. We greatly appreciate that. Talking about some of the things that TALA has going on. We currently have a survey out. If you got our latest TALAView, I would encourage you to please take that. We're asking all positions within a community to fill out the survey. It's quick, and we're really getting at why did you come to senior living? Why are you in senior living? And we're trying to build out some recruitment tools around those questions. So please take that survey if you haven't already. Also, we have our in-person managers course coming up on next week, September 4th through the 6th. It's going to be in San Antonio. If you need any CEUs, it's a great way to get CEUs. And if you need the AL managers course, it's all 3 days in person. And then I would like to remind everybody that our Ruth, who is our AI mascot that lives for our members, to please take advantage of that. She is there for all regulatory, statutory questions pertaining to assisted living in Texas. It's a great resource. I use her all the time. I love her. And so please take advantage of that. And then the last thing I would like to remind everybody is, believe it or not, we have our conference keynote RFP will be going out at the beginning of September. The teleconference will be in April of 2025, and we have already begun planning for next year. So if you are interested in trying to be the teleconference keynote, please be on the lookout for that. That will go out at the beginning of September. And that process is long, and we have a conference committee made up of our provider members that select our keynote. But if you are interested, please be on the lookout for that. Speaker RFPs will also go out this year, but not probably until around October. So that's all I have. Once again, Justin, Lori, thank you so much. This is just fascinating. I can't imagine where we will be in 5 years, 10 years, as we go down this path. I think the impact to assisted living is going to be phenomenal.
Absolutely.
So,
thank you so much for hosting us.
Thank you. Thank you so much.
you're very welcome. Everyone, please have a great weekend and enjoy. Take care.